right. Thank you, everyone. Welcome to another episode of the 40 Under 40 Public Health Catalyst Awards, Cohort 2 for the Boston Congress of Public Health. I am your co-host, Dr. Candace Carpenter, one of the co-chief executive officers of the Boston Congress of Public Health. And we have another guest with us today, Donté Smith, Oxon. Donte, I'm not going to go ahead and try to introduce you because I want people to do themselves justice. So feel free to let the audience know a little bit more about you.
Yeah, I'm Donté Smith, or Donte Oshun is my performer name. I'm a lecturer, I'm a health educator, and a technical assistance consultant. And I wear a lot of hats. I also work at Save Inc. here in Kansas City, which is the oldest housing organization for folks living with HIV. And I'm a supervisor there for tenant-based rental assistance programs.
Awesome. Thank you so much. Yeah, so I was going to ask you, Donte, where you were zooming in from. So you're in Kansas City, and I'm in Los Angeles, so a little bit of a distance away. But can we just, dive into what really got you interested in all of the work that you do? I mean, you said there's a lot of different hats, but maybe if you wanted to walk us through how you got interested in some of those things.
Yeah. So some of them, I would say, and this is probably my draw into public health in general, came from my own background. Some background on me, I was diagnosed with HIV in 2009. And I was actually part of a wave of Black and brown men of sex with men and queer folks of color who were diagnosed during this time period in 2009, from 2009 to 2011. This wave has kind of still continued. And my diagnosis really, I think when people face those kind of diagnoses, they either clam up and they turn inward, or they turn outward and decide that they're gonna, do something in their communities. And for me, that's kind of what started all of my work. So a lot of my work kind of stems from it in one way or another. So whether that's like the sexual health lecturing that I do at universities, with Sex Discussed Here, like speaking to young people about just like healthy relationships and sexuality, to my technical assistance work, which is like supporting organizations and kind of expanding their reach, being more holistic in their approaches, and working with target populations.
Yeah, absolutely. And so, say more about this wave that you said, like, that you felt like happened in 2008 and then happened at other times. I know that we've had other people discuss this in previous things that we've done before, but I think it's very important for the activism that you do and spreading the word on HIV positive and the LGBT community, especially like depending on what parts of the country as well. But could you say more about why you think it's a matter of waves and why that might be happening?
So we epidemiologically, we can like trace this we can trace like HIV diagnoses and sort of waves. And there was the kind of like modern wave of diagnosis. So what has continued from 2008 on has seen increasing rates of men who have sex with men of color, and gender variant folks like myself. I identify as genderqueer of color, particularly Black folks in the South, and folks under the age of 30. So from that 18 to 25 range. I was part of that initial wave of folks who were diagnosed then. It kind of, I've always been kind of drawn to activism and community building. And so I think that's the way I channeled kind of my kind of like health concern. I decided I should be doing something with my community.
Yeah, absolutely. And so you mentioned the activism. What advice would you give other people who might be in a similar situation where whatever diagnosis it might be, right, that they might be facing, it could be HIV positivity or something else. What advice would you give them in terms of facing whatever it is, that they're facing, and being able to turn that around for positive and to become an activist in their local community or larger community?
I would say, one, like, understand your history. Like all of our communities bring a certain sense of power and intelligence and worthiness to the world. So understand that kind of like have that sense of history about your community. Like, so for a great example of this is the reason we think of healthcare as a human right is in part thanks to folks living with HIV and the activism of like groups like ACTA. So kind of understanding your history makes it easier to kind of like ground yourself in a sense of worthiness and saying like my community is doing things, we are worthy. And then to like understand that your voice is powerful, and so seeing that like the ways that powerfulness can like exist are really nuanced, and like there are lots of different ways. So be imaginative. Like don't box yourself in saying like my diagnosis means I only live my life this way, you know, or my work only looks like this, right? I think that that's can be the beauty of having a really big imagination, as you can see lots of different options of the ways your work can look.
Yeah, absolutely. So I think that resonates pretty strongly, like being very imaginative, transcending whatever it is, like the box other people might want to put you in, or the box that you yourself might initially put yourself in.
Yeah.
Donte, what's some of the work that you've done that you're most proud of?
So I led for about a decade or so. I led patient navigation teams in the South, and led syringe service programs, drop-in spaces for youth, ran those programs in the Midwest and Chicago. I was part of an AmeriCorps team in 2012 that was actually awarded an Alexian Brothers Award for our project addressing food deserts in a housing facility for folks living with HIV. So I think I've been able to do like little different projects that I've been like really proud of, where I'm like, okay, I feel really proud that the patient navigation teams that I ran in the South, part of these larger FQHCs, are, you know, they're doing things in other parts of the country people haven't even started doing yet. Like I'm talking about like offering PrEP and HIV navigation and Hep C navigation through telehealth options, like things that like like starting co-visits as like a form of care with infectious disease providers, and doing that for like all ages through, you know, through like I said, through telehealth lenses. I'm really proud of my teams being able to like have started those projects and to see them like grow. And then, you know, the last thing that I've been doing with NASTAD for the last year around hepatitis engagement, particularly around using a drug use of human rights lens, and saying like, if we want to increase engagement around hepatitis C treatment and get more folks cured of hepatitis C, we need to shift our thinking around stigma and bias around substance users and create safe spaces for them. I've been really proud of the fact that being able to work with health departments like the Houston Health Department, the health departments for Idaho and New Hampshire, and really walking these health departments through this whole new way of thinking about their clients and thinking about them in this more holistic way that also addresses like underlying stigmas that really keep people from engaging in programs. So yeah, I'm really proud of that stuff. I feel like I didn't necessarily think that's what my work would look like, but I'm glad that it has looked like that. Yeah.
That's awesome. Thank you so much, Donte. And I feel like there's a lot to unpack. So with these interviews, we don't necessarily assume that everyone has the same level of public health knowledge or social justice knowledge, because we want to be able to democratize public health. So people who are just starting their public health journey, maybe watching, listening to this for the first time. So if you could, for the audience, unpack things, what you mean by the different pathway programs, PrEP programs, co-visits, that I know what you mean.
Yeah.
Audience, what can they understand about those things?
So PrEP is pre-exposure prophylaxis. It's a preventative medication that a person takes to ensure that they are not living with HIV. At Legacy Community Health, which is a federally qualified health center that I worked at, I led a patient navigation team, and one of our priorities that we established was a teleprep program, so offering interested clients, most of these folks sliding scale, underinsured, low income folks, offering them access to PrEP through a telehealth lens. And so typically this is a model that is only accessible to folks with insurance and folks with money. And so to offer this in a community-based atmosphere, in a community health model, was really innovative, and it's one of the only programs like that existing in the country. And I'm really grateful to have been able to like make that happen and be a part of that and lead that team to do that.
Yeah, absolutely. And then to your second point about like being able to decrease stigma for those people who might be living with Hep C. Just curious about what we can do to be able to decrease the amount of people living with Hep C, as well as educating more people about that. Like how can we make that better understood? Because I think it's not something that not too many people, unless they're in that space, really think too much about it.
Yeah, I mean, I think that it one comes from an understanding that we expand the idea of risk and shift it to thinking of vulnerability. So, for example, typically when we think about hepatitis C, we say, is this person at risk of being exposed to hepatitis C? We run through a typical behavior list. Do they use substances or inject drugs? Did they have surgeries? Do they engage in like street economies or sex work? And so that way of viewing the populations that are particularly at risk for hepatitis C exposure, viewing that as risk, instead of saying like, actually, this is just a vulnerability that happens because of these shared networks. So increasing the idea of who's vulnerable. So I think that really one of the ways we can do that is by saying like, one, everyone should be tested for hepatitis C at least once in their life. Everyone. And we increase that to include certain special populations. Pregnant folks, for example. One interesting thing that has happened in the last recent years is we've seen a rise in pregnant folks being living with Hep C and needing to get Hep C treatment because they weren't included in those regular screenings. It wasn't one of those things that we were screening for until right before pregnancy. And then including more folks than just baby boomers, because typically we were just saying, we felt like, oh, only baby boomers were typically exposed to hepatitis C. But thanks to the opioid epidemic and I would say a national reshifting of values when it comes to substance use, that population is like a lot bigger. There are a lot more folks that are potentially could be vulnerable to hepatitis C. And so it's us shifting those dynamics. I think the other way we do that is by supporting community programs like syringe service providers, like community health models. Those are going to be the way, those are where people are going to be the most comfortable sharing those behaviors that they're stigmatized. They might not be comfortable talking to like a normal provider. It's going to be in those community health models. So by supporting them, we feed into a healthier dynamic.
Yeah, I love that. Just the way, so instead of from the medical model, right, of thinking about those at-risk people, but thinking about those who've been traditionally not seen as being vulnerable to Hep C, as you said, the elderly, those who are pregnant folks, but then other people within shared communities as well. The next thing I wanted to ask you, Donte, that is particularly interest of me, is for some institutions, the movement to incorporate more knowledge about LGBTQ health. And from my understanding, since this is not the work that I necessarily do, but just kind of a side interest, is it seems like there's more of a just kind of lip service to let's do more with LGBTQ health, but not necessarily seeing that translate into the way medical students, nurses, or other healthcare providers are educated. And so I'm curious about like your opinions about that. And then also because you said the community model you felt is more effective, like, is there more LGBTQ health coming through the pipeline for community health workers?
Yes and no. I feel yes in the sense that I have had some success with talking with nursing students, pre-med classes across the country around things like HIV stigma and LGBTQ health. No, in the sense that there is a lot of lip service still happening. There's a lot of like kind of like me, and I think that that comes from this kind of sincere urge that people have to like reach out to communities, but to be honest, a lack of people putting their money where their mouth is, like not funding programs, whether that's education curriculums or diversity staff or training, not folks not putting the money behind the kind of like training that people need. But I think that the thing that is shifting is so legacy community health is one of what they call the Seven Sisters. So these are federally qualified health centers that originally started as LGBTQ clinics that kind of moved into this federally qualified health system model, opening themselves up to everyone. And so these clinics are now all over the country. Howard Brown in Chicago, the LGBT Center in LA, Callan Lord in New York. There are a couple more. Oh, I should have remembered this. I worked there. CrescentCare in New Orleans. So that all over the country now we have these are massive, systems now. Like at Legacy, my last patient load for a year was about 1,200 patient interactions. So these are a lot of patients who are now coming to these clinics now all over the country. And so these models have expanded. So in some ways I do see like it's kind of diffusing itself out, like that kind of LGBT health is kind of being diffused into just, this is included the same way we talk about other special populations, right? This is just another thing we add to the catalog. And so that, I do think that is really exciting. I think the other side of this, and I just have to speak to it because of the political climate, is that it is a politicized work, like highly politicized. There are a number of jurisdictions across the country that criminalize or have made illegal different forms of LGBT care for youth, trans youth specifically, and so that is worrisome. Because these kids don't go away. These youth don't disappear. They still need healthcare. You're just forcing them to travel further. You're ostracizing their families. You're making their lives more difficult. So it's a mixed bag. It's definitely like it's an interesting time to be in the work.
Yeah, I think you make so many great points in terms of, like, as you said, the diffusion of the LGBT, health networks around the country, but then at the same time, the neglect of trans youth in particular and their health needs, as you said, like being forced to travel further or to suffer with their healthcare needs. And they do not disappear. Eventually they become trans adults. And then, all of the compounding health needs that they've had, and then either, those that are not just physical, but also mental as well. Switching gears a little bit, Donte, I noticed in your bio that it mentioned that you'd been a political prisoner. I would love for you to unpack that, any insights, from that experience for the audience.
Yeah, so my sophomore year at Georgetown, I was arrested at the School of the Americas. School of the Americas is now known as WHINSEC, the Western Hemisphere Institute for Security, Education, Cooperation. It's a military training base in Fort Benning, Georgia, that has trained a lot of. It's a military soldiers captain school, basically. It's trained a lot of soldiers who have been connected to a lot of what are known as the dirty wars in Latin America. So the wars, civil conflicts that happened in the 1980s and 90s, mostly the 80s, in Latin America, in places like Argentina, Bolivia, Chile, Colombia, and is still connected to. The school is still connected to training soldiers all over the world, particularly still in Latin America and in the Caribbean. So some of the soldiers connected to the School of the Americas have been implicated in, for example, recently in Haiti. in like connected to some of the conflict in Haiti. So
Mhm.
I was arrested there my sophomore year at Georgetown, um, going on to it's an act of civil disobedience that happens every year at the school, started by a Catholic priest
Mhm.
he started it in the 80, before I was born, actually, like 83 or 84, going onto the military base, playing the homily of um, Archbishop Oscar Romero. Oscar Romero was killed while he was delivering a homily about nonviolence. He was like
Mm.
murdered as he was preaching.
Mhm.
And so Father Roy, to commemorate him, went onto this military base and played his homily to those soldiers. And so I was arrested there, like along with about 25 to 30 other people. Most of those folks were nuns and priests, but there were a couple other peace activist
Mhm.
folks. And I was, and I don't know. I felt like there was a connection at the time. I was doing union organizing at Georgetown, and so I was organizing with janitors, and I just saw a connection between the ways that for example, the Salvadorian sanitation workers at Georgetown were displaced, and
Mhm.
they were forced into like a a situation where they were working at a university like Georgetown, working an unlivable wage, and that
Mhm.
was due in part to our military policies that caused that displacement to begin with. So I just
Mhm.
saw those connections in my head, and that was my reason for getting arrested there. So I did 3 months in the feds.
Uh-huh.
I worked out a lot. I read a lot of books,
Mhm.
and it was definitely like an eye opening experience. But yeah.
Yeah, absolutely. Would you say at any time did you learn something that you feel has really transformed who you are today?
I think I learned then that you're that like there is no accounting for where your passion will take you.
Mm-hmm.
It's like I didn't necessarily expect, like when I went to Georgetown my freshman year, I didn't expect that, like, oh, I was gonna get arrested on a military base because I felt the connections between like Latin American displacement and like the lack of living wage at the university. I didn't see those connections going there, but my passion took me there. Um,
Yeah, absolutely. And did that whole experience ignite more of the activist inside of you, or I'm just very curious.
yeah, it did. I mean, after that, I started doing a lot of, well, once I got out of prison, I did a lot of community organizing. I started organizing like music festivals and events, and organizing festivals that were community building. So like both fundraiser for community organization, but simultaneously hosted by the community organization. So they're featured in the show, and then incorporating things like testing and health education into those programs. And yeah, I think that I think it was a weird kind of thing that happened where I was like, oh, okay, because I was actually kicked out of Georgetown for this in part. So it was like it shifted my life where I was like, okay, I'm not in school right now, but I have all this space to do community organizing. And so yeah, it did spur something else in my life. Yeah.
Mhm, mhm. Yeah, very fascinating. Something that I imagine they thought that would deter you or maybe squelch out the activists did not, in fact, do that. Um,
No.
exactly. So I'm seeing, just looking at the time. So last question for you, Donte. If you had a magic wand, and you could make changes in public health, social justice, in the US or abroad, because you obviously have interests in other parts of the world, what would those changes be?
Oh, so many wands. So many wands. I think it is addressing stigma and fear. Um, the ways that like our preconceived notions, our stigmas, our like ableist culture alienates people from getting tested and treated, for example, like HIV or hepatitis C, or the ways that stigma like keeps people from caring for themselves or makes them afraid of engaging in healthcare systems. I think that if I could make one thing disappear that would make all of our lives a lot easier, I think it would be that. It would be eliminating stigma.
Yeah, absolutely. And I think the work is something that you continue to do, and that here at BCPH we try to do by making interviews like this available, educating as many people from the much younger generation to the older generation, hopefully that's watching as well. So any final thoughts before we end, Donte?
Thanks for featuring me. I'm really, as someone who's like a traditional public health person, you know, like I don't come from a traditional public health like degreed background. Like I have some college experience, but I'm like, I don't have like a master's and those sort of things. And so like I really appreciate being included as like a featured person in the workforce. Like I think it can be really difficult for us as a traditional folks to kind of like be seen. And so I'm grateful for the shout out and appreciate the highlight.
Love it, love it. Yeah, no, we definitely feel at BCPH we have that intersectional public health lens. We're not trying to just be very traditional, orthodox public health, but public health basically lives everywhere, and anyone can take up that torch. So thank you so much again, Donte. This has been an awesome interview. So for our audience, for anyone who's listening, if you want to learn more about Donte, feel free to go to their page and learn more about them, connect with them on LinkedIn. And as always, turn into the next episode for the 40 Under 40 Public Health Catalyst Awards. Thanks so much.